Small improvements look insignificant. 1% tighter discipline, 1% sharper planning, 1% cleaner execution. Individually, they feel trivial, but in surgery, trivial compounds. 1% becomes the difference between uneventful healing and a complication you carry for months. Today, I'm giving you the 1% playbook, the micro-optimization checklist that elevates implant outcomes through sheer discipline. After 30 years in surgery, I've learned that biology drives success. This channel explores implant and oral surgery, how the body responds, how we can improve healing, what the science shows, and how disciplined surgical execution turns evidence into results. Welcome back. Today, we are covering the 1% advantage, the marginal gains system for predictable implant outcomes. Marginal gains means you don't chase a revolution, you upgrade 100 tiny steps, preoperatively, intraoperatively, postoperatively, and maintenance, 1% at a time. That's how you build predictability. Preoperative 1% place. The surgical safety checklist. There's 3 poses: before anesthesia, before incision, before leaving the room. It reduces complications and deaths globally, yet most implant teams don't use it. Adapt it. Patient, site, implant, grafts, antibiotics, allergies, consent, imaging. Tune the modifiable risks. Every unresolved risk steals stability and healing capacity. Smoking increases early failure, push for 4-week abstinence. Glycemic control. Poor HbA1c raises infection risk. Coordinate with the GP. Periodontal stability. 0 active disease before you drill. Vitamin D deficiency correlates with early failure. Screen high-risk groups. Oxidative stress, chronic inflammation and metabolic disease, slow healing. Stabilize systemically. 3. Antibiotics. Single pre-op dose when indicated. Amoxicillin 2 grams. 30 to 60 minutes pre-incision. Not 7 days, not just in case. Pre-procedural rinse. Chlorhexidine 0.12% for 30 to 60 seconds. Simple and effective. Skin and field prep. Extraoral with chlorhexidine alcohol outperforms povidone iodine. Engineer primary stability. Work backwards from bone quality to your prosthetic plan. Implant design, length, osteotomy dimensions. Match them to your load protocol. Use torque and RFA trends. Never one magic number. Intraoperative 1% place. Temperature is everything. Bone dies at 47 degrees Celsius for 1 minute. Make sure you have sharp drills, copious irrigation, intermittent pecking, moderate RPMs, minimal pressure. Replace dull drills early. Guided sleeves trap heat, so compensate aggressively. Touchless, aseptic discipline. Open implants only when you're ready to insert them. Change gloves if possible before insertion. Hydrate your grafts and membranes. Reduce unnecessary handling. Undersize only in soft bone, not everywhere. Selective undersizing boosts stability without overcompression. Verify with torque and RFA trajectory. Hemostasis and clean field. Clear blood. Maintain visibility. Tranexamic acid mouthwash helps high-risk bleeders. Clean sockets and threads before seating. Don't trap debris under your implant. Flap perfusion and tension management. Your flap design determines your complication rate. Release for passive tension-free closure. Tension creates exposure. Sutures and knot security. Use the smallest caliber that holds. Monofilament for contaminated fields. Triclosan uncoated sutures when site-specific infection risk is high. Standardize your knot sequence. Final irrigation and seating. Flush bone chips thoroughly. Sit with controlled, deliberate pressure. Let the bone see saline, not heat. Immediate postoperative 1% place. Smooth analgesic curve. Scheduled non-steroid anti-inflammatory drugs plus paracetamol for 24 to 48 hours. No peaks, no valleys. Antisepsis without collateral damage. Default, warm saline 3 to 4 times daily. Chlorhexidine delays epithelialization or reserve it only for high-risk cases, 5 to 7 days maximum. Early problem detection. Review at day 3 to 7. Look for dehiscence, hematoma, infection, or uncontrolled pain. Catch the cascade early. Maintenance 1% place. Structured supportive care. Every implant patient enters maintenance. High-risk patients need more frequent recalls. This alone cuts complications dramatically. Measure, don't assume. Talk, ISQ trends, tissue levels, bleeding indices. Data removes guesswork. Data builds a protocol. Attack biofilm early. First bleeding on probing equals immediate intervention, mechanical debridement and renewed hygiene coaching. This prevents peri-implant disease better than any magical product. Continuous improvement loop. Post-case debrief. Lock in 1 micro movement each week. Update checklists every quarter. Incremental becomes exponential. You don't need a breakthrough, you need consistency. 50 small habits executed relentlessly until they compound into predictable success. Implant mastery grows 1% at a time. Thank you for watching. Please like and subscribe.